take home of this document is that if you weren't on blood pressure meds before and your blood pressure is borderline, you're probably going to need medication, according to the American Heart Association right now. So if you're one of these quote unquote pre-hypertensives that come in my office and they don't want to take medicine and they're, oh, you know, doc, white coat hypertension, pre-hypertension, guess what? Now these guidelines are telling us we need to be treating you with medication.
That's terrible news for me.
Are you one of them?
Yes, I am.
Yeah?
Yeah. So, and I'm a terrible patient. I get lazy and I don't take my meds, and then I have high blood pressure, and then I take my brain down. So I'm glad you brought this up. I'm just going to take my meds and be a good boy from now on.
You should. and really what these guidelines are calling for is for people to use a risk calculator called the Prevent Risk Calculator, which is like a calculator online. You can find it with a Google search. And you basically put in a few biometric parameters like your age, your weight, a couple other things, and it's going to give you a 10-year risk score of heart disease. And here's the twist, though, because if your risk is above 7.5%, they recommend treating blood pressure now at 130/80 with medication. So it used to be 140/90 a few years ago. They made it 135/85 with the last guidelines. Now we're down to 130/80. So they're bringing the bar down if you're above 7.5%. But even if you're lower than 7.5%, they recommend a 3-month trial of lifestyle. And if you don't get it under control, medication at that point. So pretty much everyone at blood pressure over 130/80 now should be on medicine.